Hi guys, I'm Dr. Matt Gianforte. I wanted to take a minute today and explain to you what is stem cells and how is it really changing how people are regenerating and healing in their body. You know, some people will ask me, well, you're a chiropractor. What do you know about stem cells or why are you guys doing stem cells? Well, let me kind of share with you the evolution that has happened inside of our practice. You know, when I got out of practice, 13 years ago, both my wife and I graduated from chiropractic school, and we started taking care of people, and people were getting amazing changes and amazing results just with chiropractic and what we did in chiropractic. And it was fantastic. But what we noticed was that patient history and what they were telling us wasn't matching up with what we found on their exam. You know, it was very common for a patient to come in and say, oh, I've got low back pain, or I've got neck pain, or my knee hurts, or my ankle hurts. But it always could typically be tied back to something that they say happened 2 or 3 or 4 weeks, or maybe even a couple months ago. Oh, I injured my low back while I was lifting, or I slept funny the other night and my low back hurts, or you know, my neck hurts now that I've been sitting at a computer for 2 or 3 months now. And so we would evaluate and we'd find that there was issues that were going on. But when we took the x-ray, we realized that the x-ray didn't match up to what the patient was actually telling us. What we found on the x-ray is that these acute conditions that patients were coming in with were really chronic degenerative changes that were happening within the spine that have been there for years and years and years. And I'm not just talking spinal joints, I'm talking like knee joints, hip joints, ankle joints. All these joints that we were assessing, we realized that we were treating them acutely to get them out of pain. However, these problems have been around for many, many years because we're starting to see changes happening on the bones, okay, and degeneration happening in the bones in the joint space. So what we did about 5 years ago is my wife and I, we had to take our practice to another level. We had to be able to get our patients, more stable long term. And after a lot of research and really digging in deeper, we realized that we really had to start incorporating muscle care, muscle therapy, and rehab care into our treatment. And what we found was that patients were getting much longer lasting results than just chiropractic alone. So we integrated our office medically, and we brought a team of practitioners together from a medical doctor and a nurse practitioner to chiropractors, and we've got some rehab assistants, all to really create a comprehensive program for our patients. Well, there was one other thing that we started to realize, that once we started integrating and we're really helping people stabilize, we realized that their joints were not regrowing. We realized that there was actually another therapy out there that could help regeneration start to happen within joints, and that was stem cell therapy. And it really was a really nice progression from what we had done in our practice to helping patients really start to regenerate their joints. So that's why I want to talk to you about stem cells, because stem cells is kind of this evolving field, right? Or it's this evolving treatment technology. And it's really regenerative stem cell therapy is what it is. And it's been around for really quite a long time. It's not as new as people think. It first started, they found stem cells in blood, and then it was bone marrow, and then it was umbilical cord blood. And not too long after that, in the 80s, they started finding it in adipose tissue or fat tissue. Okay, and then in the 90s, with our technology that improved, they realized that stem cells are actually found in all tissues of the body. Okay. It was just harvesting them that was a challenge. And so literature now shows that the stem cells that we get from our own body actually have some deficiencies to them, okay? Primarily age and any disease processes that are potentially going on in the body, such as autoimmune diseases, can affect the effectiveness of the stem cells that we get from fat, or we get from bone, or we just get from ourselves. Now, there's some very healthy people that at younger ages, 20s, 30s, even early 40s, that don't have any diseases at all, no autoimmune diseases, that those stem cells would work very well from themselves. But there's been this new line of new technology of getting younger stem cells from amniotic tissue as well as umbilical cord blood. And what I want to talk to you about today is the umbilical cord blood, because that is a stem cell that our nurse practitioner uses, a product, I guess, that our nurse practitioner uses from Livion. And those stem cells from the cord blood have shown some really amazing changes happening in people. And so to identify as a stem cell has to have two primary qualities, okay? The first quality is it's got to be able to proliferate, which means that it's got to be able to go from 1 stem cell to 2 stem cells to 4 stem cells to 8 stem cells, okay? It's got to be able to proliferate into itself more and more and more stem cells, okay? Umbilical cord blood does that very well. The second thing that it has to be able to do, it's got to be potent. And potency means that it's got to be very effective at differentiating into other cells, such as cartilage and bone and muscle tissue, nerve, and whatever tissue that it may need to differentiate into, okay? And so umbilical cord blood from healthy births have been found to be very, very potent as well. So the question is then, how do stem cells work? Well, how do they know what to go to? So your body, when injured or when inflamed, gives off chemical signals. So damaged cells will give off chemical signals. And that's what starts to attract the stem cells and the growth factors and the cytokines and all the healing factors that are in along with the stem cells in the Livion product. And so that attracts to that area. And that's when the differentiation and multiplication begin to happen and the regrowth process of a particular joint or tissue, okay? Now, what we do specifically in our office is actually helping with osteoarthritis and knee joints and hips, and we've got the capabilities to help with disc issues and joints in the spine as well, shoulders, ankles, things like that. And so what are the functions of a stem cell? What makes it so great, really? It's not like you put the stem cells in and then just something miraculously happens and just changes them immediately. But there's a process that has to happen within the body. And the body begins to, these stem cells begin to grow inside the body. And there's really 4 qualities or 4 features that stem cells have. One is they're anti-inflammatory. And so why is that so important? Well, inflammation and degeneration, really anywhere in the body, is associated with inflammation. So stem cells have the ability to give off anti-inflammatory type of chemicals, okay, and cofactors to decrease inflammation in the body. They're also anti-apoptotic, okay. What that means is that when a cell goes through death, it's called apoptosis, okay. And so it's a programmed death of a cell that isn't doing well. It's not healthy, okay? Well, when the stem cells get into those areas, it can actually help to revive those cells around it, meaning those cells that are not healthy, they're not doing well, that those cells can give it the nutrients that it needs in order to regenerate the current cells that are inside of that area. Another thing that stem cells will do is they're antimicrobial. And so that's so important because stem cells have the ability to attack bacteria and viruses and protozoan. There's actually been some some research out there on protozoans with Lyme's disease. Okay, and then finally, it's also antifibrotic, meaning that it can break down scar tissue, okay, and help to regenerate the tissue around the joints. So, what are the advantages of using a product like Livion and umbilical cord blood? Okay, well, one of the advantages is it has an abundant amount of mesenchymal stem cells. Okay, stem cells are really the basic building blocks of all tissue within the body. One of the advantages also of using the umbilical cord blood would be that there's not an invasive procedure that's associated with it. If you use adipose tissue or bone tissue, there's an invasive procedure of going in and harvesting those stem cells. The great thing about Livion stem cells is that it can just be put right into the cell or right into the joint, and there's no harvesting of that. And really the other advantage would be is that they're younger cells. And what the literature shows is that these younger cells haven't had disease develop on them yet. They haven't had the aging process, so they actually become, and they are, more effective many times than our own stem cells. And they've been shown to be highly proliferative, multiply into itself, and differentiate into other cells. So, stem cells. Is it a new technology? Not really, okay? We're just learning a lot more about it and how it functions within the body. There's a lot more research that has to come out to see how it can be beneficial for other diseases other than osteoarthritis and autoimmune and some of these other diseases. Now, in our office, we just focus on osteoarthritis and degenerative joints, okay? There's a lot of stem cell clinics out there that are out there promoting it for osteoarthritis as well as other types of conditions. Now, the challenge that I have with that is this, okay? We have to ask ourselves, why did the body break down to begin with, okay? Why did a joint degenerate? Well, according to the literature, 80% of the time why joints begin to degenerate is because of biomechanical dysfunction, meaning the joints just aren't biomechanically sound, okay? They're not strong enough. They're not tracking properly, okay? Wear and tear. So, if you have stem cells put into a joint, but you don't go through the proper rehabilitation to strengthen and support and correct the alignments within that joint, what's going to stop it from breaking down again like it did the first time? So one of the things that we always like to try to incorporate into our regenerative procedures is let's stop or reduce the cause of the problem to begin with. And then you can even look at autoimmune diseases. There's offices out there that are putting stem cells in for autoimmune type diseases, right? Well, the one challenge I would have with that, while it's still very good and it's going to help the autoimmune disease, you still have to find the root cause of what's creating the inflammation in the body. Okay, it doesn't reverse or cure anything, but it will slow down the progression according to the literature. So it's still critically important that regardless of putting any stem cells in your body, you still have to find the root cause and begin to correct that as well. So while LifeWorks here, we use stem cells for osteoarthritis and joint pain, and it's been incredible for our patients. In fact, you can see on our website some of the testimonials of patients that have seen incredible changes, okay? I do want to emphasize that it's still very important to correct the root structure and get the alignment corrected as you're going through this process with the stem cell regeneration over time. So hopefully that helped to answer some of the questions about stem cells and how they're used, and the different types of stem cells and what we do here at LifeWorks. So if you haven't liked us yet on our Facebook page, please like us. Get this data, because I think it's so important that people get the right data and they just continue to educate themselves about their health. Like us, share this video, and continue to follow our posts. Thank you.